Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, May 4th, and we are here to answer your COVID questions. You can see I'm joined by a guest today. This is Dr. Candace Robinson. She is one of our communicable disease medical directors at the Chicago Department of Public Health. She was actually on Facebook with me back
a few months ago, around when flu campaign began.
There you go, when we were focused on getting flu vaccines out, which we did a very good job of and had a very, almost non-existent flu season here in Chicago. But she's been heavily involved in immunization since and is here to help answer some questions and talk a little bit about what we've seen. So do you just want to introduce yourself just a little bit, tell folks what you've been working on?
Certainly. So yes, like you mentioned, I'm Dr. Candace Robinson, pediatrician by training, here in Chicago as one of the communicable disease medical directors. Since in COVID, I've really been working primarily on the COVID-19 vaccine rollout, working on, with our providers and getting the vaccine out into hospitals and clinics, and working to get the message out to answer questions and interact with patients as well. So.
Thanks. Dr. Robinson is one of the people who has been working very long hours, like past midnight some days, to make sure that, vaccine, especially when vaccine was in really short supply, it was a lot of work every week to say, here's all the vaccine that's coming in, let's make sure we're dividing this up, getting it to the places that are most needed, make sure we're sorting through everything. So huge thanks to you and, to your whole team. All right, so let's check our distance real quick. Obviously, we are both fully vaccinated, but we continue to want to really demonstrate that good social distancing, particularly because, just as a reminder, if you are in public spaces broadly, if you're in crowds, mask wearing is still recommended. So we have it off as we have throughout this show, but we're keeping distance as a result. So let's take a quick look at the data. I've got some other updates, and then we want to get in and talk some more details about vaccine with Dr. Robinson. So chi.gov/COVID- is, as always, your update for all things COVID in Chicago. And if we look here, you can see, again, good numbers. This is what we want to see. We're at a 4.6% positivity. You see that's down from 4.8% a week ago. Our testing numbers still remain very good. We're averaging almost 13,000 a day, down just 4% from a week ago, and generally well above the minimum of what we need to be testing. And our cumulative cases and our daily case average are now at 508. Still higher than we'd like it. We'd like to get that number under 400 and ideally under 200, but you can see it's down 7% from a week ago and continuing to head in the right direction. So everything's looking good there. I think we can come off of this, and I'll hand it over to you. Give us an update about vaccine progress here in Chicago. How's it going?
Yeah, Chicago's doing very well, actually, with the vaccine and the vaccine rollout. Right now, we're at a point where over 50% of Chicagoans over 18 have gotten at least their first dose of vaccine. I think we're right around 56%. And then if we look at Chicagoans over 65, that number is even higher. We're over about 66% of Chicagoans over 65 getting their first dose. So we're doing really well with that. One thing we're also looking at is how many Chicagoans have completed their vaccination series.
Yes.
So how many have gotten those 2 doses if they got Pfizer or Moderna. And I think for those over 18, we're at about 40% who have completed, and over 65, we're at about 55% who have completed. So we're doing really well. We're getting the vaccine out, and we have Chicagoans getting vaccinated, which we're very excited about. But we also want to make sure that Chicagoans go back and get that second dose and complete their vaccination series as well. Yeah, we're doing well.
We've seen about 9%, give or take, at this point. We're not clearly seeing a second dose in the computer. The team is doing some work to match up records. My guess is there probably are people who got it in a different place that we're still doing some matching. But that's really true across the country, that it's been in the sort of 8 to 9%, that we're not always seeing people get that second dose. So,
indeed, that second dose is important. So if you've got that first dose of Pfizer or Moderna, make sure you're getting your second dose of those vaccines as well.
Yeah, and do you want to talk a little bit about that? Like, why do we need that second dose?
Yeah, we really need that second dose because that second dose actually makes that vaccine provide the most protection that vaccine can give you. So for example, in the Pfizer trials, after the first dose, it was about 50% effective in those trials. But after the second dose, it was 95% effective. So really that second dose is important in really boosting that immunity up to the most protection that vaccine can give you.
Yeah, exactly. And we'd had a question in last week, and I said I would come back with a little more data about sort of second doses and what do we know about those. And I did pull this one study that they did in Houston, and they looked at more than 90,000 people who had been seen. Some of them were vaccinated, some of them were not. And they looked at everybody who'd been hospitalized with COVID and then looked to see, were they vaccinated, were they not vaccinated, what did that look like? And they'd had 225 deaths among people who were hospitalized, right? And of those 225 deaths, 219 were not immunized at all. 5 were partially immunized, meaning that one dose of the 2, and then they'd had one death at the point this study was done in someone who was fully vaccinated. But when they looked at all this data, they found, because in the real world, we know that one dose is certainly partially protective. What they found in this study was that for people who were partially vaccinated, it was about 77% protective against hospitalization, about 64% protective against death. And then when people got that second dose, it went up to that 96% protection against hospitalization, 98% protection against death, sort of in a real world sample. So, this is just one study. People are certainly looking at this. We do, no vaccine is 100% protective there, but definitely getting that second dose is important to get the, the best protection that you can. We know with the second dose, you get more, you have a higher level of what's called neutralizing antibodies. Antibodies are the protection that your body makes, and neutralizing antibodies are one type of that. And I was reading Dr. Paul Offit, who is really a leader in terms of vaccine science in the U.S. He's on the FDA panel that looks at vaccines. He was saying, based on the data, it's about 10 times the level of that particular type of antibody after the second dose versus the first. And there's another kind, like immunity is complicated. There's a lot of different types. And this cellular immunity, which is another way that you get protection, you just get much higher levels after that second dose. And so particularly where we're concerned about variants, getting 2 doses is important.
Indeed, absolutely.
All right. Let's look at. I've got just a couple of updates for some folks here, and then we'll get into some more vaccine questions. So go ahead and start putting in your questions for Dr. Robinson. You can put them in the box below, or you can use the hashtag #AskDrArwady on either Facebook or Twitter. So I'm going to pull up here just a couple of announcements before we start or get into the details. Let's see. Okay. So first of all, we do have an update to our travel order today. And the main news is that Indiana, unfortunately, is seeing a surge in COVID cases. And they're now averaging 16.7 cases per day, which does put them over that 15 case per day limit and puts them on the travel order list. So as a reminder, the states on this map, the ones in orange, it also includes Michigan, which of course is starting to come down, but has had just a very bad outbreak. Minnesota's also had a very bad outbreak, and unfortunately we're seeing increased in Indiana. If you are fully vaccinated, 2 weeks post your second vaccine, you do not need to worry about this map. You do not need to test, you do not need to quarantine if you're coming back to Chicago from an orange tier state. But otherwise, if you're coming from an orange tier state, you need to either do a 10-day quarantine or you need to have a negative test result. And you can test before you get to Chicago, you can test immediately after you get to Chicago. But if you're testing after you're back in Chicago, you got to quarantine until we've got that negative test. So again, you want to not have to worry about this sort of thing, just get vaccinated because your risk just becomes so much lower. So that was the major update, but you can see here which states, unfortunately, are still seeing somewhat higher cases of COVID. And then I just wanted to also make an announcement, our Protect Chicago music series. So we talked a little bit about this last week. This is where, as part of Protect Chicago, we're putting on some concerts, some neighborhood events that are celebrations of vaccination. So when people have been vaccinated, they're able to gain access to these concerts. And so the first one is going to be May 22nd. It's going to be in partnership with the Silver Room and DCASE, and then Apostolic Faith Church. So DJ Ron Trent and Dwayne Powell are going to be performing, and the Silver Room, which some of you know is very popular, is going to serve as the promoter for the event and will host the will call the weekend leading up to the event and the day of the event. So to attend this event, you do need to be vaccinated. It's going to be in the Hyde Park area, and there will be more details to come there. But because fully vaccinated means 2 weeks post that second dose, or 2 weeks post the first dose if it's J&J. This May 8th, which is Saturday. Sorry, we'll double check. May 8th, whatever day May 8th is the day that we will be having a vaccination event at Apostolic Faith Church. Yeah, it's on Saturday, that's what I thought. Saturdays is when we have a standing vaccine availability anyway at Apostolic Faith Church. But May 8th in particular, there will be an incentive vaccination event. So if you come, you get vaccinated at that event, you will be offered a pass to attend the first event of our series on May 22nd with DJ Ron Trent and Dwayne Powell. If you are already vaccinated though, don't worry. You will still be eligible and able to get a ticket. Starting Monday, there will be tickets available. You got to bring your CDC vaccination card and they'll be available through the Silver Room. There's going to be some things up on Eventbrite, and you'll be able to see more about that on our website. But just wanted to highlight this Saturday, your easiest way is if you get vaccinated that day, you'll be offered a pass to this event. So excited about that. These are the sorts of things we want to do to really, incentivize vaccination in a way that's very positive. And thanks to everybody who's helping pull that together. I also just wanted to highlight our vaccination station schedule. That's the Vax Bus. So tomorrow we'll be in South Shore at Atlas Senior Center, 10 to 2. Thursday, we'll be in Englewood at the Red Shield Salvation Army, 9 to 1. And Friday, we'll be in Austin at the North Austin Library, 10 to 2. And we're continuing to experiment with different ways to bring this bus out, set up tents, really bring vaccine to where folks are. And you're going to hear much, much more about that, particularly when we talk about some of our strategy for kids. We do have lots of appointments available right now, ZocDoc.com/vaccine and at 312-746-4835. If you know anybody in Chicago, call that number. We will get you sorted. We'll find you an appointment. If we need to sort out transportation, we'll help get that sorted. And again, all of the city sites also have walk-in available, so you're welcome to do that. And then the last announcement is just that the United Center has completed its initial 8-week engagement. So from the beginning, the federal government had agreed to help sponsor an 8-week mass vaccination site here, and it's been so helpful. I mean, we've done more than 250,000 doses,
Yes.
Is that right?
Yes, that's correct.
So we've finished week 8 of our Pfizer vaccines, and we're going to do 1 week of Johnson & Johnson. So starting today and for the next week, Johnson & Johnson is available. You can walk in or you can sign up. You'll see if you go to ZocDoc.com, it'll tell you specifically it's the Johnson & Johnson vaccine. And we know that there are people who are really interested in getting the J&J vaccine because it's that one and done vaccine. The side effect profile is a little bit lower. And so this is a little bit to see what the interest is like. And then we'll be completing out the United Center. We'll just do 1 week of J&J, and then those last couple of weeks we'll be finishing second doses for people who need it for Pfizer. So there are drive-through options also available on ZocDoc, but starting today, you can walk into or make an appointment at the United Center if you want J&J. And then on the vaccine coverage, like you were saying, our epidemiologists really every single week track how are we doing in Chicago compared to all other cities. And where we look at the cities that have the highest population in the US, it's good. Like as of the 29th, which is the last time they ran this, Chicago had the highest coverage. We were at about 44.6% of all residents. We're up to, I think, 46 now that have gotten at least a first dose. But then really what we've been pleased about is that our coverage, particularly for Latinx and Black non-Latinx Chicagoans, is doing better than any of the other large cities. We still have a long way to go, to be really clear on this. Like we're seeing, you can see here about 50% of Asian Chicagoans, about 52% of white Chicagoans, excuse me, have gotten a first dose, whereas only about 36% of Latinx Chicagoans and now about 30% of Black Chicagoans. So we definitely, given that especially Black and Latinx groups have been hit the hardest, want to see increases there, and we're doing a lot of work, and thanks to everybody in those communities who's been helping get the word out. But when you compare this across the other cities, we are actually doing a little better, which tells us the whole country has a long way to go in terms of working on this. But our age 65 plus is still lagging. We've got about 67% of people over 65. And you can see most of these cities are in the 70 to 80% range, and the country's at about 80%. So if you know anybody over 65 especially, please, please, please help them get vaccinated. All right, so let's go ahead and turn to some questions. I'm gonna pull this up here. All right. Oh, right off the bat, we've got people wondering about the kids. So, so yeah, can you go ahead and just give us an update on COVID vaccine for children?
Absolutely. So right now, with the 3 COVID vaccines, Pfizer is the only one that's authorized for persons under 18. Right now, today, Pfizer is authorized for persons who are 16 and 17 years of age. Now, Pfizer has also submitted to the Food and Drug Administration to seek authorization for their vaccine to be used in kids 12 to 15 years of age. And we actually anticipate that they will make a decision on that maybe even as early as next week. Now, what's important to note is that, there have been clinical trials that have been going on for 12 to 15-year-olds. So this has been studied in this age group the same way it was studied in the adults before it was authorized for use in adults. It's also been studied in our 12 to 15-year-olds as well. And what they found, it works from those studies, the high-level overviews, it worked very well, been very protective in that age group, and they found no serious safety or concerns about that. And so we'll get more of that data as the FDA, makes that decision. Similar to the adult vaccine as well, once the FDA makes their determination, the CDC's advisory group will meet and talk about vaccine use and use of that vaccine in that age group. So that could be coming as soon as next week for 12 to 15-year-olds, but for Pfizer only at this time.
Good. And Alexandria Deanne is following up on this, wondering, with Pfizer likely getting approved, what are your recommendations for parents, and are kids seeing the same potential side effects?
Yeah, so the recommendation for parents are the same as their vaccination for themselves. You really want to get your kid vaccinated to make sure that they are covered and protected, get that most protection from that vaccine against COVID. So the recommendation will be the same if the FDA authorizes it. Get vaccinated. And I think the side effect profiles for kids are, it's probably some of the same things we see, with vaccines with adults. The sore arms and things like that are kind of the most common side effects after vaccination, and things that kids see, after their vaccination with their routine vaccinations as well. But no serious safety concerns have been identified with the use of Pfizer in this age group at this time.
That's right. And I think, when, just like has happened for the other vaccines, all of the data will be very available on this. So we'll be able to share, the details of what percentage of kids had a sore arm, et cetera. But from the preliminary information that I've seen, they were not seeing higher side effects in kids, and they were seeing very, very good levels of protection when they looked for antibodies in the blood, actually even a little better than what they'd seen in the young adults. So things looked really good in the trials here. And absolutely, the recommendation will be, assuming that the FDA and the CDC give that recommendation to get vaccinated. And I would just double down on it a little more to say get vaccinated soon. Don't wait until just prior to school. We know kids are wanting to do sports this summer and go to camp and be with friends, and we still have a lot of COVID around. And the ability to have, especially when I think about being able to have kids over 12 vaccinated, we know older kids more likely to spread COVID than the youngest kids, and so really excited about the possibility of having a vaccine. Okay, so Steve Williams just quickly is saying, why is the city only using J&J vaccine at the United Center? Today is actually the first day we've ever used J&J vaccine at the United Center. We've used Pfizer for 2 months up until now, but we're doing a 1 week with J&J, partly because we're interested to see whether people are interested in getting it, and because we can do 1 week of that one dose, and then we'll finish out the engagement at the United Center with Pfizer. So, okay. Jess P. on Twitter is saying, as of Saturday, the zip codes with the lowest first shot rates are all on the south and west side. 60621 Englewood was at 24%. Thank you for pulling my data for me. 60624 Garfield Park was at 27.8%. Parts of Austin were at 28%. South Shore was at about 29%. West Englewood was about 29%. Are there localized plans to address this?
Yes, absolutely. So this is absolutely something we're working on, this really kind of what we call hyper-local approach to vaccination, really engaging with community-based organizations. And if you'll remember, this is something that we started with the Protect Chicago Plus, where we started kind of in those hardest hit communities with hyper-local vaccination events, meaning just bringing vaccination events into the community engaging with the community-based organizations and the trusted messengers in those communities to get people to these vaccination areas. And so this is absolutely something we're very focused on still, making plans for continuing kind of that work local within those communities, particularly in the communities that have our lowest vaccination rates currently, to work with the community, to work with the messengers, and to bring vaccine to the community to get people vaccinated. So I think you'll continue to see these very hyper-local events. You'll continue to see the vaccination station bus kind of going around in these areas, and other events will be coming as well so that we can ensure that vaccine is available. As always, of course, our mass vaccination sites are still available. We still have Chicago State running down on the south side. Kennedy King right now is still open down on the south side. There's vaccination events at Loretto on the west side. And so we do have some of those mass vaccination sites in those areas as well, but we will continue to work on these kind of hyper-local in-community vaccination events as well.
Yeah, and I would just echo that a little bit. We've been talking to folks, in the communities and thinking about how to, use trusted messengers to carry that vaccine. Thanks to everybody who participated in our Faith Month events. We had about 70 different congregations across the city really, make vaccine available to their congregants, and we know how important some of that is. I think you're also going to hear, where we've been talking to folks on both the south and west sides about, are there ways that we can, increase that convenience, increase that access, maybe make it a little more fun. So just to give you a little sense of some of this. So, like this concert that we're talking about, this is going to be on the south side, and my understanding is these are DJs who would be very popular among younger folks, and wanting to sort of think about ways to incentivize this. Not that the vaccine itself is not enough incentive, but what else can we do that? We're going to be doing this Vax and Relax, which is working with some of the barber shops and nail salons and hair salons, and thinking again about, where are people potentially gathering, where are they spending time, and can we pair vaccination with, a free haircut or free nails. And then we're going to be experimenting, over these next few weeks with some new really efforts where we're going to go knocking on some doors and really talking to folks about, are you interested in getting the vaccine? We're going to be bringing a station or a bus near you and seeing what that kind of uptake is like. I think, my sense is that there are a lot of people, and I'm curious what you think about this. I think there are a lot of people who, it's not that they've said, I don't want to get a vaccine, it's just that it's not top on their list of things to do, right? It's like, it's there like with the oil change. It's like something I should do, but maybe, there's a whole lot of other things going on in my life. What's your sense of that?
I agree. I think we really want to make it such that vaccination fits into people's lives, fits into people's routines. I think we all have very busy schedule, and sometimes it is a challenge to, go somewhere else for vaccination. But I think, it is important though to remember, this vaccine provides protection. And so, moving it maybe just slightly above the oil change, on the list is good. But we'll also, as a city are looking for ways to help bring it to people so that, you don't have to choose between that oil change and the vaccine. We really want to make it as convenient as possible for people to be vaccinated.
Maybe oil change would be a good place to offer vaccine.
So there we go. There's an idea.
Yeah, we've been thinking about, where do people wait, right? Like people wait at the DMV, especially right now because it was closed for so long. Like you'll see, I've been trying to pay attention as I've been going around to Chicago. Where do I see lines? Where do I see people potentially waiting? People wait at laundromats. People, may wait if they're trying to access other services. And the goal is just to make this easy for people, and then have somebody who can also answer questions, right? And really make sure that you're having some of that one-on-one conversation. One more thing, actually, providers. Can you talk a little bit about what we're doing with providers? Because I know that's been near and dear to your heart.
Yes, absolutely. So we are, I think the vaccination rollout really started with vaccination through hospitals and these large sites. But ultimately, we really want vaccine to be accessible through your provider, the same way that the flu vaccine is accessible through your provider and other routines are accessible through your provider, is ultimately what we want with COVID vaccine. So we're really working with providers to make sure all of our providers are enrolled and ready and able to accept COVID vaccine so that, when you do go for your appointment with your provider, they have the vaccine and can offer it to you there. So that is absolutely something we're very focused on, both for adult providers and for pediatric providers with potential vaccination of 12 to 15-year-olds on the horizon.
Yeah, absolutely. And I think, I'd like to get to a point where all the emergency departments have a COVID vaccine available and you're offering it every time someone's seen in the emergency department or every time you're getting discharged from a hospital, or, just thinking about where can we fit it into existing practices, and again, just make it available for people. So, all right. So lots of questions here. Aprem Johanna is asking, I recently got my meningitis shot 2 weeks ago, and I scheduled my vaccine for COVID for tomorrow. Should I wait or should I get it? Will getting the COVID vaccine affect the meningitis shot?
So CDC actually recommends to wait 2 weeks between vaccines and the COVID shot. So if you got your meningitis vaccine 2 weeks ago or 14 days ago, then you can absolutely proceed with getting your COVID vaccine. And then after you've gotten your COVID vaccine, CDC is currently also recommending waiting 14 days before you get a different vaccine. But you've gotten your meningitis shot more than 14 days ago, absolutely proceed with getting that COVID vaccine.
Yep. All right, great. We've got a couple of questions here about people with immunocompromise. So. Or other issues. Nancy V says, I have a friend who's on anti-rejection medications due to a transplant. These meds canceled out his 2 vaccinations. Do you know if there's another solution for him? And then we also had Alexandria Deanne, the second part of her question was about, is there a concern the vaccine might not work as well for immunocompromised people? My family member takes immunosuppressants. I'm worried she might not be protected as we first thought, even though she's fully vaccinated. So comments about folks who may be immunosuppressed or post-transplant?
Yes, so right now CDC does recommend vaccination for persons who are immunocompromised or post-transplant, et cetera. I will highlight though, we always say, talk to your provider.
That's right.
If you are immunocompromised, you're on any medications, you should still always absolutely consult with your provider when making vaccination and other healthcare decisions. But CDC still does recommend vaccination. I think there's still ongoing work about how well it works in people who are immunocompromised. But I think it's an important thing to still be vaccinated because you're still getting, some level of protection from that vaccination. So absolutely talk it over with your provider, but it is still recommended that they be vaccinated.
Yeah, absolutely. And to sort of build onto that a little bit, we have seen some examples of people who are very immunosuppressed. So like the person who wrote in and said the friend is, maybe recently post-transplant, where when they look for antibody levels, like when somebody gets vaccinated and they draw their blood, they're really not seeing high antibody levels, so they may not have that full protection. But there's not and again, talk to your doctor, but generally speaking, it's not that there's a problem with someone who is immunocompromised getting vaccinated. Like
right.
Dr. Robinson said, you 100% should get vaccinated, but there may be in people who, are immunocompromised and especially more severely immunocompromised, like you might be right after a transplant, or some of the people who have, are in treatment for like leukemia, lymphomas, et cetera, you may not get as high a level of protection. So it's definitely been seen. And for people who are seriously immunosuppressed, it's a discussion you should have with your doctor, but still 100%, broadly speaking, the recommendation is still to get that vaccine, because even if you're maybe not getting the full protection, getting some protection is especially important, because we know people who are immunocompromised are more likely to have the serious outcomes. And so, to take this one step farther, I think where someone who is seriously immunocompromised, they're going to get vaccinated, but still, where there's a lot of COVID around, that could be a setting where if, they really want to make sure everybody who's in close touch with them is fully vaccinated,
Absolutely.
right? It becomes extra important, and probably taking some more care with masks, et cetera. Not common. Most people, especially if they're on mild immunosuppressants, it's not been an issue that we've seen, but it is something for some folks who are more severely immunocompromised. Good question. Here's one that's I don't know if we know the answer to this, but if anybody does, it'll be you. John Special is saying, is flu vaccine production going to be impacted this year? What do we know about that?
Ooh, I have not heard of any impacts to flu vaccine production. Typically, the manufacturing plants are, ramping up and doing their own vaccines. The flu plants will still be planning to make their flu vaccine. Flu vaccine is still going to be very important this winter and fall, so be prepared to get your flu vaccine this year as well. But I have not heard as of yet of any impacts to flu vaccine, so I don't anticipate that there will be any.
Yeah, and what's interesting is both the Moderna and the Pfizer vaccines, they use this mRNA technology, which is, has been amazingly effective, but it's a different way of making a vaccine than the way flu vaccines are made traditionally. And so all of the ways in which we make flu vaccines, it's not like we took all of those over making COVID vaccines. So yeah, I think, flu vaccination's not going anywhere. I'm really interested, I don't know if you have thoughts about this. We don't know what this flu season is gonna look like, right? Like we had, to my knowledge, like one ICU admission for flu or something this year. I mean, normally, we have hundreds and hundreds of these. We normally have a lot of deaths from flu right here in Chicago. We have pediatric deaths really every year here in Chicago from flu, influenza. But because, a lot of people did a good job of getting their flu vaccines, but then also we were all masking and washing our hands and keeping our distance. And that just did an amazing job in terms of really cutting that spread of flu. But there's some questions about, what will that mean for next flu season? Will we continue to be careful? Will we see it lower? Have we broken some of those chains of transmission? Or because fewer people were exposed last year, will it come back even stronger? I don't know if
that would be an interesting question. I mean, I think this flu season really shows the power of masking and social distancing,
hand
washing, and what that can really do to really, bring our flu season and our flu rates very down. I think another thing we saw, and I remember there's a study that we looked at the last time that showed some of the childhood infections were lower with the masking and the social distancing.
Exactly.
So we will have to see kind of as things evolve over here the next few months, how that looks this flu season. More to come on that.
Absolutely. All right, Scott Cowan is chiming in here with a suggestion, which I love. People wait at airports, train stations, bus stations. I like it. If you've got thoughts and suggestions, put them in here. We read them, and we're definitely thinking about planning and what some of that could look like. And then he's also asking, what is the rate of first responders being vaccinated? I saw a report of low numbers for CPD. So I saw that yesterday as well, and I do want to put it in a little bit of context. So Chicago Police Department had the opportunity very early on to get vaccinated through the city of Chicago, right? They were really right after the first responders in terms of the medical personnel. They were really in that next group to have vaccine offered. And we know that about 25% of the Chicago Police Department got vaccinated, I think it was 27%, got vaccinated through that on-site employer city-based clinic. And we did a lot of work to really educate. Obviously, this is fairly early in terms of vaccine being available. And we have seen increases in vaccine confidence as the months have gone on. And we now have, more than 2 million shots in Chicago, more than, 240 million across the US and almost 1 billion around the world. I think people do feel more confident, having seen, everybody knows somebody who's gotten vaccinated at this point. So we know that there are CPD officers who have been vaccinated outside of that workplace setting. So I don't actually have the full percentage in terms of what percent have been vaccinated, because think about how vaccination works. We are very careful about, I don't actually mean vaccination, but the vaccination information. We don't collect a lot of information about people who are being vaccinated. We're really careful and conscious about, privacy and how that data is being used. And so we keep really just minimum data in terms of your name, your date of birth, your address. We do collect race and ethnicity now, which is actually a newer requirement that we put in place as a result of COVID, and then which vaccine you're getting and the actual lot number, so we know you get the right first and second. And really that's it. We do not ask people, who is your employer? We do not ask people, what is your job? We don't ask people, what is their underlying condition? And so I don't have a way at sort of a systemic level to push a button and say, X percent of teachers or X percent of doctors have been vaccinated. But certainly across all of these workplace settings, we have been encouraging and re-encouraging people to get vaccine and working to make it available. Because obviously we know, because we saw high rates of COVID among police officers, that they are obviously exposed a lot and are a group that we'd like to see well vaccinated. Okay. C. Scooby Manny is chiming in. Thank you for the information. I know a senior that was a breakthrough case and had no symptoms, which is the point. Get vaccinated, people. Agree. And we've got a couple of other folks, a couple of questions here about breakthrough. Maggie Canine on Facebook. Can you talk about breakthrough cases that have occurred in Chicago? Are there variants? What does contact tracing tell us? So I think I'm going to pull up a little bit of data here, because I promised people last time that we would talk a little bit more about breakthroughs if we got another question. So let me pull this back up. And I had the team pull this. So here in Chicago, we've had more than 700,000 Chicagoans that have a completed vaccine series, 2 weeks post their second dose or 2 weeks post their first dose if they got J&J. And at this point, we've identified fewer than 500 breakthrough cases. So that's 0.06% of those who had a completed series. And as the person wrote in, the great majority of these people were asymptomatic, meaning they did not have symptoms at all, but they were tested for work, for example, or they're in a setting where there's routine testing, or maybe they had to travel, or whatever the case may be. So the great majority did not have symptoms at all. And of course, that's what we want, where the vaccine's being protective. We did have 48 hospitalizations where people were fully vaccinated here in Chicago. We're still looking at the cause of some of these, but I can tell you folks mostly were older, no surprise. The median age was 72 and the range was from 24 to 97 years. And there have been 5 deaths in total in people who are fully vaccinated. That is way, way less than 1%, right, of all the people who were vaccinated. And when you compare the number of people, like in that study that I shared, the huge majority of hospitalizations, deaths, have all been in people who have not been vaccinated at all. But we do have occasional cases in breakthrough. And so when that happens, we look every single time that someone is vaccinated, every single time someone is diagnosed with COVID, we're looking behind the scenes to say, were they actually fully vaccinated or not? Mm-hmm. And if they were fully vaccinated, that would meet the definition of a breakthrough case. Mm-hmm. And then we're working to try to get that lab sample to check and see, is it related to a variant? We've actually not seen most of these breakthrough cases be in variants. Their variants are part of our picture here, but kind of not the whole thing. But the overall, unbelievable how good the protection from this vaccine has, but nothing is 100%, obviously. And this is just some data about our variants here. The B117, which is the UK variant, the one that first emerged in the UK, we've diagnosed, about 450 cases of that here in Chicago, another 1,600 or so outside Chicago. And you can see, going all the way down, we've detected really all of the variants of concern here, that P1 in particular. And I saw another question someone had about the P1 variant, so that's where we're getting into this. We've had more of that. And this is just showing you, this goes by week of the year. So in light blue here are the B117, and in yellow are the P1s, and so on from there. And really each week we are detecting more of these, but it's only in the ones that you test, right? Mm-hmm. So we know that there are a lot that you don't test. They're all over the city. This is the geographic distribution here in Chicago of known variant cases. And again, not every single case is getting checked for variants. So it's not that this is all of them, but we do know that these variants of concern are spreading person to person in communities. So the purple dots here are where we've diagnosed someone who had a B117 variant. And the green are the P1 and the orange are the B1427, et cetera. These have mostly not been in travelers. Early on, we had a couple of cases that were in travelers to the UK, but at this point, we're really detecting them separate from each other in most cases, and not in anybody who's traveled internationally. So it's just reflective of the fact that we have more variants here. The vaccines remain protective against all these variants. Can't say that enough. You got to get vaccinated. But this is where we're seeing them. And just to have a little more detail, of the people who we've diagnosed with that B117 variant, about 4% of them have been hospitalized, so 96% of them, right, not sick enough to be hospitalized, and 1% died. And then we've had 5 that were tied to a known outbreak. And then among the P1, we had 7% hospitalized, so again, 93% not hospitalized, no known deaths, and we've had 2 tied to a known outbreak. So we're definitely continuing to keep a really close eye on this. We can come out of the slideshow. we invested here in something called Ripple, the Regional Innovative Public Health Laboratory, new for us here in Chicago. About $3.5 million. CDPH working with Rush University is the lead here in terms of using a lot of their ability to do more genomic testing and sequencing, but we're bringing in samples and working with hospitals and other providers across Chicago. And we've done some hiring of people with really like good skills in this space, and this is new for us. Like the ability to be able to do this more advanced genomic and molecular testing is something we've wanted for years. And with COVID, there was some additional federal investment and ability to do some more of that. So, all right. Let's see what else we've got here. We're almost coming up on time. Let's take, still a lot of questions. Let's take Don Wolf maybe as the last question because it's a good one for a pediatrician. I have a 10-year-old. Right. What should I and other parents be doing this summer to protect our unvaccinated kids?
Absolutely. So we still have guidance for unvaccinated persons. So it's still really important, you know, when people who are unvaccinated and people who are vaccinated still, but in indoor spaces, you're still wearing your masks and social distancing when you're, you know, unvaccinated persons. CDC has released kind of new guidance about the mask, particularly when you're outdoors. And in some scenarios outdoors, you know, even for the unvaccinated kids, either masks aren't recommended. However, for a lot of scenarios, masks are still recommended for your unvaccinated kids. You should still be avoiding large crowds, things like that to keep your kids protected. I think it's, one thing we know is that, you know, the vaccine manufacturers are studying the vaccine down to 6 months.
Yep.
Both Pfizer and Moderna currently have studies that are ongoing for vaccine down to 6 months. So maybe into next year, we may actually see vaccine for our people less than 12 years of age. So stay tuned for that and keep looking out. But in the meantime, you know, there'll still be some protective things that the children will need to continue to do because they can't get vaccinated. So still make sure they're washing their hands, wearing their masks, social distancing in the appropriate settings, and following the CDC guidance for persons who are unvaccinated. And certainly if you have anything to add to that.
Yeah, no, I think that's perfect. The main thing is if you can get all the adults vaccinated around the kids,
Very
risk
important.
really goes down a lot. And then assuming teenagers come in here too, I don't know if you got an older brother or cousin, et cetera, but like, you know, the best way to be protected is to be surrounded by a lot of people who are vaccinated themselves. And then as our case numbers go down here, right, like the risk will go lower and lower and lower, but that's absolutely where we are this summer. So thanks. I am going to take one more because they sent in, this was someone who emailed a question in, and I want to take it. Moira Fierncombe and friends. It's a little bit long, but I think it's a good question. Since the pandemic, many of us have been playing bridge online. Now, several players would like to resume in-person play. Having been cautious for so long, we wonder how safe this will be because sitting at a bridge table is most definitely not socially distanced. Precautions would include everyone being double vaccinated and hand sanitizing before play. Should mask wearing be mandatory? Does it matter we'll be playing in homes where we don't know who's been coming and going? Some players have been more adventurous than others about going out and being with family and friends. Is this an issue? And then she says, we hate being COVID wimps, but don't want to do something silly just for a game of bridge. Yeah, thanks for that. So I'll start, and if you want to chime in. So, you know, the most important piece in there was this requirement that everyone's been double vaccinated. And if everyone has gotten both doses of their vaccine and they're 2 weeks post that, you can gather. The recommendation is that you can gather without masks indoors if everybody is 2 weeks post that second vaccine. And I would just add on to that, assuming that everybody's feeling well, right? Like if you're having symptoms, right? Like don't, you know, that has not gone anywhere. That was the first thing we ever passed for COVID and it's still part of it. But assuming everybody's feeling well, you're 2 weeks post that vaccine, you can gather and be playing bridge. And so, you know, this is not about being, so on a couple pieces of this, it doesn't matter that you don't, if you're in a home, you don't know where people are coming and going. We know that COVID does not live for, you know, long periods of time on surfaces. As always, the risk is really greatest when you're interacting with living, breathing other people. And if all of those folks are vaccinated, really the risk is low. I would say, you know, to the point about the immunocompromised, if there were someone who, you know, were seriously immunocompromised, you know, that could be be, one condition where maybe you would still want to be wearing a mask, but that's very, very unlikely, and that would be something that that person would know with their doctor. But broadly, yes, like the good news about vaccines is this is how we get past COVID. This is how you move from online bridge to in-person bridge, and you feel comfortable doing that. And I want to encourage people, if everybody's fully vaccinated, to be coming back to these in-person small gatherings. I think it's one of the ways all of us are kind of coming out of COVID at different rates, if you know what I mean. And I think it's taken it's going to take us a little bit, I think, to get used to the idea that we can be out and about, and what does that look like? And one of the safest places to start is with small in-person gatherings with people who you trust and that you know are fully vaccinated. Anything you want to chime in about the Bridge Group?
No, I think that's important. Vaccination is key. Vaccination is our light at the end of this COVID tunnel and the way back to those bridge games. And
Absolutely.
so absolutely small gatherings acceptable for those who are vaccinated.
Good way to start. Okay, so we're at time. Just in terms of some good news, One Summer Chicago is going to be back this summer. It was last year too, but this year there's going to be more in-person opportunities. And if you don't know, One Summer Chicago gives about 20,000 young adults age 14 to 24 summer jobs. So work with government institutions, community-based organizations, companies. You can apply, if you know anybody 14 to 24, www.onesummerchicago.org. There's really some cool stuff on there. And sometimes we even have people at the Chicago Department of Public Health from One Summer Chicago. So I'd encourage people to apply for that. And then we did a press conference this morning with the mayor and the governor highlighting that the auto show is going to be back. Normally it happens in February every year. Couldn't happen because of COVID. But it is going to be happening July 15 to 19 and at McCormick Place. And there's going to be an indoor part, an outdoor part, and they had some of the cool cars, and it's exciting, every day about really hearing more about some of what we're planning. And vaccine is really the key to us continuing to get past all of this as a city. So that was some good news. Anything you want to chime in? Good news or anything else?
I think that's great news. I think, we'll continue to see us reopen here and continue to see Chicago come back to summertime Chicago. So get vaccinated, everyone, and we'll see you out there.
All right. Thank you so much. Dr. Candace Robinson, one of the medical directors at the Chicago Department of Public Health, has been living, breathing all things vaccine for months now. So thanks for tuning in. We will be back on Thursday at 11 a.m. Central. See you then.